Margie. I'm going to introduce you to Maria, who's going to show a small PowerPoint presentation and talk a little bit more about the hardcore research and evidence that supports yoga in practice. Thanks.
Thanks, Judith. I will start my screen sharing. So just give me one moment. Now, is that showing? Yes?
Yes.
Great. Beautiful. So as Judith and Margie have mentioned, I'll be giving a brief overview of the evidence for yoga in supportive care in cancer. Oh, 1 second. So yoga in the scientific and clinical communities is increasingly recognised as a complementary or integrative approach to diminishing the onset and severity of cancer-related symptoms, or indeed treating these symptoms. The research to date has shown that the flexibility and acceptability of yoga among patients with cancer who are undergoing treatment and into survivorship. So this means that people with cancer find that they can and are willing to undertake yoga programs. As you can see from the graph on the screen, that the number of published studies looking at yoga in cancer has risen dramatically since 1975 on the left, with only a couple of studies, to 2017 on the other side with about 60 studies. So it's really exciting to see the growth in the research in this area. And as a very brief overview of the mechanism of action behind how yoga is thought to address cancer-related symptoms, and Margie touched a bit on this, I'd like to take you through this diagram on the screen. So the various techniques of yoga that you can see on the left-hand side, such as breathing, meditation, physical postures, and others, are thought to have a number of effects on different body systems. For example, the hypothalamic pituitary axis, which is what mediates the stress response, as Margie was talking about. Also the circulatory and lymphatic systems, and likely others as well. So the effects then in turn are thought to act on a number of functions in the body that are here depicted in the blue, such as the circadian function to normalize the rhythm, as well as a stress response to decrease cortisol, on the physical function to increase cardiopulmonary function and muscular function, and also on the immune system to decrease problematic pro-inflammatory markers and increase beneficial anti-inflammatory functions. So the overall effect in the orange/yellow of all these actions of yoga is to improve various cancer-related symptoms like sleep disruption, fatigue, cognitive impairment, mental health, and musculoskeletal symptoms such as joint and muscle pain. And indeed, it has been reported that people with cancer do take up yoga to manage these symptoms. For example, a very recent study from earlier this year in 507 participants with breast cancer found that they used yoga after their diagnosis to improve their overall wellness and relaxation, or also for flexibility and balance, as well as to manage cancer-related symptoms. So as you can see from the graph on the screen, that for all of the symptoms, including those mentioned in the last slide, like fatigue, sleep, joint and muscle pain, depression, and anxiety, as well as others like quality of life, lymphedema, peripheral neuropathy, and nausea, were all reported to be improved following yoga practice. So in the black bars, you can see what the level of symptoms were before the participants practiced yoga, and in the white after their practice. So those bars are all a lower level of symptoms. And I have also carried out a survey in Australian participants for my PhD that were diagnosed with cancer, and I actually found similar results to the benefits that they had seen from doing a yoga practice. So that was really nice to see as well. So those results are from people's reported experience with yoga and not formal trials. So then if we go into the evidence coming out of the trials of yoga programs, a review from 2019 that looked at 29 randomized controlled trials, which of course are the gold standard way of measuring effects of treatment in research. They reported the number of studies that had significant findings, that is, that the symptoms improved after the yoga programs. So in the table on the screen, you can see that there are a number of cancer-related symptoms that they looked at, like quality of life, fatigue, pain, sleep, different physical biomarkers, as well as psychological effects like anxiety, depression, distress, and cognition. And they've broken that down into participants that were undergoing treatment, that had finished treatment, or were a mixture of both. And I've added the totals there as well. So you can see the number of randomized control studies that have found positive results in this population. And just one thing to note as well is the number of studies will actually be higher now, as there have been more conducted for the various symptoms since this was published. And this study also looked at, only included publications in English. So this is really an underrepresentation of the actual numbers that are out there. Importantly as well, based on the strength of the evidence that has been gathered to date, as Margie mentioned, clinical practice guidelines have been developed by the Society for Integrative Oncology, and they've been endorsed by the American Society of Clinical Oncology. These recommend yoga with either a high or moderate certainty of benefit for various symptoms, and this is specifically in women with cancer where the most evidence exists. And these include for anxiety, depressive symptoms, fatigue, quality of life, and sleep. And in addition, in 2020, so last year, the European Society for Medical Oncology also published guidelines that said that yoga could be an option to improve fatigue and quality of life. So this recognition of the evidence is really great to see. So while we have more and more positive evidence of the effects of yoga on cancer-related symptoms, there is still more work to be done to tease out the exact mechanisms and answer various questions. These include finding out more about which types of symptoms yoga is better at addressing, if there are differences, and if the effects differ between different types of cancer or stages of cancer. Most studies so far have been done in women with breast cancer, so more research is needed in other cancers. And one of the things I'm addressing in my PhD is what specific practices and techniques in yoga are best for helping with mental health symptoms. And I'm doing this through a Delphi study, which is a consensus study with yoga teachers and therapists. We also need to determine the optimal dose for different symptoms and which type of yoga is most effective. Because studies so far have varied considerably in the style and components taught. So we need more studies to investigate this further. But it's definitely a practice that is more gentle than your average yoga class. As Margie mentioned, it is adapted to the needs and barriers of people with cancer. And that's what the trials to date have focused on. And lastly, we also need more information about how yoga is delivered. So for example, is it a group class or a one-on-one session? And this has been the focus of the research that one of my supervisors has done, as well as mine in my PhD. And we've been finding really interesting results there. And lastly, very relevant to the times we're living in is looking at online delivery and whether that is effective as in person. And there have been some recent studies looking at yoga delivered online. And this is also something that I'm looking at in my PhD, which I'll talk about in a couple of slides. But the research in that area as well is really looking quite exciting. So what does this all mean? Based on the evidence we have so far, under proper guidance, yoga is a low-risk practice. And I haven't talked about the research behind this because of time, but all the evidence points to yoga being a safe practice with very few injuries or other negative effects in people with cancer. So it's a low-risk practice that can be added to other treatments to combat cancer-related symptoms during and after cancer treatment. And the evidence is robust and mounting for it being effective for a variety of these symptoms. And I'd just like to finish up just mentioning a few studies that we are conducting in the living room. And the research into yoga and research generally in the living room is growing at a rapid pace. So that's really great. But the yoga studies that are happening at the moment is we've got a yoga for lymphedema study that we'll be recruiting very soon. And that's for women with breast cancer related lymphedema. And that's a 12-week online yoga program. So, and my PhD, which I've mentioned a few times, I'm looking at a trial for breast or gynecological cancer patients with depression or anxiety symptoms. Again, it's an online yoga program for 6 weeks, and I'm looking at the group versus individual sessions. And we're also putting together an early breast cancer program, which is a specifically designed program to address a variety of symptoms in women with early breast cancer, and yoga will be one component of these. And if you do want to find out more information about any of these studies or any other studies, I've got my email address down below, and these will be available later in the recording as well. And that's all. Thank you for listening.